Today we will learn about congestive heart failure. Congestive heart failure is the inability of the heart to meet the metabolic demands of the body. And acute heart failure or decompensated heart failure is the condition in which heart is not able to pump the blood effectively. So blood have compensatory mechanism, or the body has compensatory mechanisms to maintain homeostasis. Homeostasis is a constant, the maintenance of constant internal environment. So increase in sympathetic activity occurs because of the compensatory mechanisms, and increase in sympathetic activity causes increase in cardiac output, and by stimulation of sympathetic activity, and other two factors are also responsible for this, like a vasoconstriction and increased renin. Increased renin will stimulate renin angiotensin aldosterone system, the RAS system, and thus increasing angiotensin 2. Angiotensin 2 will cause vasoconstriction, and aldosterone, which further releases and causes retention of salt and water. This is responsible for cardiac remodeling or the left ventricular hypertrophy. Cardiac remodeling is the group of molecular and cellular interstitial changes that occurs clinically, and the size, mass, geometry changes because after the function of injured heart, after the heart injury. Increase in the vasoconstriction of arterioles causes afterload, and that of venules increases preload, resulting in increased workload on the heart. Workload on the heart. So vasoconstriction of arterioles increases afterload, and that of venules increases preload, resulting in increased workload on the heart. So further cardiac remodeling is responsible for increased mortality, increased death rate in the CHF. CHF is congestive heart failure. Now the treatment of decompensated or the acute heart failure. It is aimed at decreasing the congestive system first. Aimed at decreasing the congestive system with diuretics, and increasing the contractility with positive ionotropic agents. So what is the function of diuretics? In heart failure, there is accumulation of fluid in lungs and the peripheral organs, which leads to congestive symptoms, and diuretics help in decreasing the symptoms, and by mobilizing the edema fluid, and diuretics of choice are loop diuretics, like a furosemide. Diuretic example of diuretic is furosemide. Now ionotropic agents. Ionotropic agents include positive ionotropic and negative ionotropic agents. Major ionotropic drugs used in congestive heart failure are dobutamine, dopamine, inodilators, and cardiac glycosides. These drugs are used for short-term management of acute CHF, the congestive heart failure, and except digitalis, these are for short-term management. Now first is dobutamine. Dobutamine is selective beta 1 agonist, which has no effect on the dopamine receptors, and this is administered by Intravenous infusion, it increases cardiac contractility and output. And dopamine, it has a dose dependent action on the dopamine, on the dopamine B1 and alpha 1 receptors. At low doses, it causes a renal vasodilation by its action on the dopamine D1 receptors. Okay, so now cardiac glycosides like digoxin, digitoxin, and ubane. So cardiac glycosides like digoxin, digitoxin, and ubane, these are collectively known as digitalis. So these are positive ionotropic drugs, but unlike other inotropes, these do not increase the heart rate or oxygen consumption. These drugs can be used for acute treatment of congestive heart failure, as well as for maintenance. Okay, these agents do not alter the basic pathology in congestive heart failure, and thus are unable to decrease the mortality or the death rate. Digitalis Digitalis is also used for treatment of atrial fibrillation and atrial flutter. Okay, and paroxysmal supraventricular tachycardia. Okay, so how the digitalis works in congestive heart failure? Digitalis acts by inhibiting the sodium potassium ATPase, okay, by these are inhibited by digitalis in congestive heart failure, inhibiting sodium potassium ATPase of myocardial fibers. This result in accumulation of sodium in the cardiac cell, which in turn leads to increased intracellular calcium and finally increases contractility. So in this picture we can see that digitalis inhibits the sodium potassium ATPase, and thus this result in accumulation of sodium in the cardiac cell, which in turn leads to increased intracellular calcium. Finally, this will increase the contractility. So ionodilators can also be used. These drugs are indicated for short-term intravenous use in severe and refractory compensative heart failure in the congestive heart failure sheet. Treatment of compensated congestive heart failure includes vasodilators, aldosterone antagonists, and beta blockers.